If you have been taking your blood pressure medication faithfully every single morning for years, yet you still feel that familiar, dull weight in your chest, or perhaps you catch yourself feeling exhausted by midday despite a supposedly normal reading on your digital monitor, I need you to listen very carefully to what I am about to explain. Many of you are starting to notice that the prescriptions which worked perfectly 5 years ago seem to be losing their grip in 2026. You are not imagining things, and you are certainly not failing at your health journey. The truth is that we have been treating the symptom of high blood pressure as if it were the disease itself. And while you are here, please take a quick moment to hit the subscribe button and the like button below, as this simple interaction helps us reach other people who are tired of managing their health without ever feeling truly vibrant. I would also love to hear from you in the comments later. Have you noticed a change in how your body responds to your daily routine over the last year? Let's dive into why this is happening and what the internal mechanics of your cardiovascular system are actually begging for. My name is Dr. Harrison Blake, and for the past 15 years, I have dedicated every working day to helping patients bridge the gap between complex clinical data and the actual lived experience of health. My goal has always been simple: to provide you with the tools to take control of your longevity, so you can spend your time living, not just surviving or waiting for the next checkup. When we look at hypertension, which is a medical term for high blood pressure, we often talk about it as a plumbing problem. Think of your blood vessels as garden hoses. If you have a pump that is running too hard, or the diameter of those hoses is narrowed, the pressure inside must rise. Conventional medicine in the past focused heavily on forcing that pressure down with chemicals. While these medications are lifesavers in acute situations, they often fail to address why the vessel narrowed in the first place. In 2026, the medical community is finally acknowledging a shift that many of us in the wellness space have been observing for a long time. We are seeing a massive increase in people who have technically controlled numbers but biologically aging systems. Why is this happening? It comes down to the concept of systemic inflammation and the health of your endothelium. The endothelium is a thin, delicate, intelligent, active organ lining inside every single blood vessel in your body. When your endothelium is healthy, it produces nitric oxide, a molecule that tells your vessels to relax, expand, and stay flexible. When you are chronically stressed, eating processed foods high in inflammatory vegetable oils, or remaining sedentary, that endothelium becomes damaged. It stops producing enough nitric oxide. The vessels stiffen. The heart has to pump harder. Your medication is like a dam gate that artificially lowers the pressure reading on the screen, but it is not healing the underlying damage to that delicate lining. This is why you still feel tired. Your body is trying to compensate for a system that has lost its natural elasticity. Let us break this down into something easy to visualize. Imagine a river. If the riverbed is clean and the water is flowing, everything remains healthy and nourished. If you start throwing debris into that river, the water level rises because the flow is restricted. Your medication is like a dam gate that artificially lowers the water level at the end of the river to stop it from overflowing, but it does nothing to remove the debris causing the blockage. In 2026, we are seeing that the debris in our modern lives, processed sugars, chronic cortisol spikes from mental stress, and a lack of specific micronutrients, is accumulating faster than our bodies can clear it. Many patients ask me if they should just stop their medication, and my answer is always a firm no. Never stop a prescribed medication without a doctor's guidance. What I am suggesting is that you add a layer of biological support that creates the environment for your heart and vessels to actually recover. The first pillar of this recovery is understanding the role of inflammation. When we talk about cholesterol, people often get scared of the total number, but the real issue is the oxidation of that cholesterol. When your blood sugar is unstable, it creates a chemical reaction that makes cholesterol sticky and prone to adhering to those damaged areas of your endothelium. By stabilizing your blood sugar through simple dietary shifts, you stop adding more debris to the river. The second pillar involves the specific nutrients required for that vital nitric oxide I mentioned earlier. Did you know that the health of your tongue and mouth microbiome plays a massive role in blood pressure? It sounds strange, but beneficial bacteria in your mouth help convert dietary nitrates from vegetables like arugula, beets, and spinach into nitric oxide in your blood. If you're using harsh antiseptic mouthwashes twice a day, you might be killing the very bacteria that help keep your arteries relaxed. Small, evidence-based changes like opting for mindful oral hygiene and increasing your intake of dark, leafy greens provide the raw materials your body needs to maintain healthy blood flow naturally. Now, let's talk about the third pillar, the autonomic nervous system. Most people living with high blood pressure are stuck in a sympathetic drive, which is the fight or flight state. Your body thinks it is being chased by a predator all day long. This keeps your heart rate elevated and your blood vessels constricted as a defensive measure. In our modern world, the predator is not a lion. It is an email notification, a traffic jam, or a worrying thought about the future. You cannot expect a medication to overcome a body that is constantly screaming that it is in danger. You must physically signal to your brain that you are safe. This is not just about relaxation. It is about biology. Deep, rhythmic breathing, specifically lengthening your exhale, taps into the vagus nerve, which acts like a brake pedal for your heart. When you exhale longer than you inhale, you force your system to shift from fight or flight into rest and digest. This is a physiological state where your body actually repairs its tissues. I often see people who are meticulously tracking their blood pressure, checking it 3 times a day, and getting anxious when the numbers fluctuate. This is a trap. The anxiety of checking the number causes the number to rise, which causes more anxiety. It becomes a self-fulfilling prophecy. My advice is to check it once in the morning, in a quiet, seated position, after you have had a moment to breathe. The rest of the time, focus on how your body feels. Do you have energy? Is your brain clear? Are you sleeping through the night? These are far better indicators of your cardiovascular health than a single reading taken in the middle of a hectic afternoon. Some of you might be wondering about exercise. You do not need to run a marathon to lower your blood pressure. In fact, high-intensity exercise when your body is already under chronic stress can sometimes be counterproductive. What you need is movement that promotes blood flow without adding unnecessary systemic strain. Walking, swimming, or gentle resistance training are excellent. They help move lymph, clear out metabolic waste, and strengthen the heart muscle, so it does not have to work as hard to circulate your blood. It is about consistency, not intensity. A 20-minute walk every day is vastly superior to a 2-hour gym session once a week that leave you depleted and sore. Let us look at the element of silence and solitude. We are the most overstimulated generation in human history. Your nervous system is constantly processing light, sound, and digital information. This constant input creates a low-level background radiation of stress that keeps your blood pressure elevated. Even 5 minutes of quiet time, perhaps sitting outside or just closing your eyes without a device nearby, can lower your cortisol levels significantly. Cortisol is a primary driver of high blood pressure because it instructs your body to hold on to sodium and water, which increases the total volume of fluid in your pipes. When you reduce cortisol, your kidneys naturally excrete the excess sodium and fluid, which directly reduces the pressure in your system. There's a recurring question I hear about magnesium and potassium. In 2026, we are realizing just how deficient the average adult is in these 2 minerals. Potassium acts as a natural adversary to sodium. If you eat a high-sodium diet with low potassium, your body cannot maintain the delicate balance required for a healthy blood vessel tone. Magnesium, on the other hand, is the great muscle relaxer. It helps the smooth muscles in your artery walls relax, which allows for better flow. While I always recommend getting these nutrients from whole foods, supplementation under the guidance of a health professional can close the gap if you are starting from a place of chronic depletion. I want to pause here and address the emotional weight that comes with chronic health conditions. Many of you feel a sense of betrayal by your own bodies. You feel that despite following the rules, you are still facing these challenges. I want you to reframe this. Your body is not betraying you. It is adapting. It is doing the best it can with the biological information it has been given. When you change the information by changing what you eat, how you move, and how you manage your stress, the body responds with remarkable speed. I have seen patients whose blood pressure numbers were considered intractable begin to stabilize within weeks once they stopped fighting their bodies and started supporting them. This is not about magic. It is about biology. It is about returning to the fundamental requirements for human health that have been ignored in favor of quick fixes. As we look at the trajectory of health in 2026, we see two paths. One path is to continue adding more medications to address the side effects of previous medications, a cycle that often leads to fatigue and diminished quality of life. The other path is the path of restoration. It requires a bit more effort up front. It requires you to be an active participant in your own care. You must learn to read your body's signals. You must learn which foods make you feel inflamed and which make you feel alive. You must learn to silence the noise and focus on the quiet rhythm of your own heart. This is the path of true health. It is the path that leads to longevity, not just in years, but in the vibrancy of your daily experience. You might be thinking, where do I even begin? Start with one thing. If you try to change everything tomorrow, you will burn out by Tuesday. Start by increasing your water intake and replacing one processed snack with a piece of fruit or a handful of nuts. Start by adding 2 minutes of deep, slow, intentional breathing to your morning routine. Start by noticing when you are stressed and taking a moment to soften your shoulders and unclench your jaw. These small, tiny actions are the bricks that build the foundation of a healthy life. They are not dramatic, but they are powerful. And when you look back a year from now, you will see that these tiny changes were the difference between merely existing and truly thriving. Remember that you are in charge of your health. Your doctor is a partner, a consultant, and a guide, but you're the one living in your body 24 hours a day. You're the one who knows what it feels like to wake up tired. You are the one who knows when the stress is peaking. Use that knowledge. Become the expert on your own physiology. When you return for your next checkup, go in with data. Tell your doctor about your sleep, your energy levels, and your daily habits. This transformed approach to your health changes the nature of the relationship with your healthcare provider. It shifts from a passive transaction to a collaborative effort to optimize your well-being. As we bring this conversation to a close, I want to remind you that the goal is not perfection. The goal is progress. If you have a day where you do not eat perfectly or you skip your breathing session, that is okay. The body is resilient. It is designed to recover. Just pick it up again the next day. Do not let the pursuit of a perfect health regimen stop you from enjoying the small, daily pleasures that make life worth living. A healthy life is a happy life, and happiness is itself a potent medicine for your heart. Thank you for being here with me today. It is truly an honor to be part of your journey toward better health and a longer, more vibrant life. If you found this information helpful, I invite you to share this video with a friend or family member who might be struggling with their own health journey. Sometimes, one simple conversation can change the entire direction of someone's life. Do not forget to leave a comment below with your thoughts on what we discussed. Your experiences add so much value to this community, and I read every single one of them. For now, stay curious, stay active, and most importantly, stay kind to yourself. You are doing the work, and the results will follow. Take care of your heart, because it is the engine that drives your entire life, and it deserves every bit of care and attention you are starting to give it today.